till now there is no such device. But actually myself is collaborating with IIT Delhi to develop such stent. Maybe in a year or so we'll be able to manufacture some prototype so that we can be launched. Okay. And in the meantime also there are so many companies which are already into, because Make in India is a buzzword now, and all are, and maybe in the 1 or 2 years we will get to see most of the stents and balloons will be made by the Indian companies.
I am working in KEM Hospital, Mumbai, and I was working with my colleague Dr. Kranti Kumar Rathod, and together we have devised a medical stent which will reduce obesity. And this design of the stent was approved by the US Patent Office, and we have been granted the US patent for this medical device to reduce weight in obese patients in April 2021. Once we have got the patent, we will further upscale it and see to it that whether this device is feasible, whether this device can be manufactured, whether this device will help us in minimally treating patients with morbid obesity. This is the only case that I know of a medical device which has been approved by US Patent Office till now amongst our interventional radiologists. There are many more in pipeline, and which we would subsequently see to it that we mentor each other and develop such devices in future.
Great.
On the device front, we have probably the only device in the world which was manufactured and designed by an Indian company and Indian doctors, and I was incidentally involved in the whole study project. This is a device which is what we call as bioresorbable stent, and that stent, the important criteria was that there was a drug on it also. So that helps to treat this peripheral vascular disease, and we were the first people in the world which we used it in humans, and that paper was accepted in Germany and in Paris, where we presented our data, and is now acceptable, and now it will be all on a manufacturing front, and within a year or so this will be available not only in India but all over the world. So credit goes to that the Indian brains and Indian minds have worked on it and have been successful in treating these patients.
Okay, great.
Bioresorbable drug-coated stent.
Okay, that is the name of the device?
So the name of the device is Credence BTK.
Okay, great. One more question to you, doctor. You mentioned that Tata is amongst the world's best training center. Now, as Indians, we are proud of this, and it's a matter of, I think, applause for everybody. But is there any certified body or any such data which says that Tata is the best training institute in the world for something like this?
Yes, I think Suresh would be the best person to answer this. He is heading that Tata Institute, and is the head of radiology also.
So regarding especially the training in interventional radiology, Tata Hospital is the first institute which has got a 3-year Medical Council of India certified DM in interventional radiology course. So we started around 4 years back. We started with 2 seats in DM in intervention radiology, and recently we got approval from the National Medical Council, which is now MCI has been replaced by National Medical Council. It has approved 4 seats of DM in intervention radiology, which is the first institute in India for training the students after MD in interventional radiology. Similarly, Tata Hospital also has 2-year dedicated fellowship course in interventional radiology, which has been affiliated to Homi Bhabha National University, which is a deemed university under which Department of Atomic Energy runs various teaching courses. So under that university we have a 2-year HBNI Intervention Radiology Fellowship course, and we also have 1-year certificate course of Tata Memorial Center itself in intervention radiology. So at any time there are 10 to 12 fellows who are getting trained in interventional radiology in Tata Memorial Hospital, and that is probably one of the highest number of students which are getting trained in interventional radiology, and that is why I am sure Dr. Hemant Deshmukh has said that it is one of the leading institutes, and it also has collaboration with international institutes like King's Medical College, London, as well as Miami Cancer Center in Florida. So we have affiliations with such international institutes as well. So one of the best training is given in interventional radiology in Tata Memorial Hospital.
Great, fantastic. And in terms, sorry, you want
To add to Sir's thing, if you take intervention radiologists in entire India, 80% of them are trained in Bombay and from KM and Tata.
Wow, great. In terms of industry impact, do we have any study which gives the number of cases that are being treated through the process of interventional radiology in this country, and what is the kind of impact it has in terms of on the industry in terms of numbers and size, and at what percentage is it growing every year annually? How many people are adopting for this kind of treatment? Is there any proper study on this? And if so, what do these studies reveal?
So this is what we call as registry data. Rather than the industry, it is the society which handles this. And we do have our registry data collection every year. And as we have understood it over the years, there is an average of 8 to 10% increment in number every year. And today I would say that, as somebody mentioned, that we have more than 1,000, about 1,100 members in our society. There is an average number of procedures that are being performed in interventional radiology is more than 50,000 per year in India. So the numbers are ever growing, and I'm sure the jump will be now much more, and that's where the media will play a role. We want to reach out to the people and tell them there is this branch of medicine which can be taken and can be helping in the treatment of a lot of patients. So the growth is very rapid. Lot of new technologies, lot of new techniques are being developed, and the growth is very rapid now.
Great. Medical tourism is booming in India. So as far as medical tourism goes, do we have people coming to India to take the service of interventional radiologists?
Yes.
It's a great question. So as we have already discussed, intervention radiology is available everywhere. But the cost and the waiting list when compared to UK and US, in India it is easily available at a better price, and it's affordable, and they can reach India easily. So all the major hospitals such as the private entities like Apollo and all these other hospitals, they are offering medical tourism and intervention radiology as a specialty to all the foreign patients. As a doctor, I have already treated many of these Saudi patients, Tanzanians, Nigerians. All these patients come down for the treatments. So it is, yes, very much available for medical tourism.
Cost is where healthcare sometimes becomes health scare. And in fact, my friend was just prompting me from behind and requesting me to ask this question to the doctors. You did mention cost, and you did mention the benefits of shorter stay and keyhole surgery or pinhole surgery, minimally invasive surgery, all those things well understand and well appreciated. But can you give us an actual perspective of cost? How does it compare with the other alternative methods of treatment?
Okay, so I will also like to answer your previous question,
yes,
especially about the medical tourism. So in fact, we do not like the term tourism when it comes to medical science, because it is all giving care and not earning out of
Pleasure.
it, as the tourism word goes to. So apart from the corporate hospitals where the rich patients from Saudi and other Gulf countries can come and have treatment in India, but especially for cancer care, when we talk, Tata Hospital, we get patients from all over countries in this part of the world. We get patients right from Afghanistan, from Nepal, Sri Lanka, Bangladesh, and they may not be very affording kinds, but they get the best treatment, best treatment at affordable cost. So that kind of medical tourism we practice. At the same time, when you talked about the cost effectiveness, as we call about this particular treatment, yes, it is minimally invasive, so it is daycare procedure. Patient do not waste many hospital days, so he doesn't lose his income or working days, as compared to the other traditional ways of treatment like surgery or chemotherapy and other modalities of therapy. The patient has to undergo a long hospital stay because he takes time to recover, so he and his family, they lose their income. At the same time, because they are morbid procedures, there might be more complications, so again the cost of other auxiliary treatment increase, that again adds to this. And as against that, with shorter stay, there is significant saving for the patient as well as from the out of the pocket expenditure for the family. So all this, if we consider together, these minimally invasive treatments, which most of them are daycare, is a big saving for the patient, and that is how they are cost effective as against other modalities of treatment.
I think the device cost must be higher, but the gain is that these patients get back to work as early. The family is back into their business or work as early. So therefore, the cost, actually if you calculate every which way, may be equal or much less than the corresponding surgical procedure. So that is what is the major advantage. So these devices have played the trick and helped treat these patients more effectively.
Just to add to that, fortunately Government of India and all the state governments have incorporated now practically all the intervention radiology treatments in government health schemes. So the Pradhan Mantri Arogya Yojana, or in Maharashtra Mahatma Jyotiba Phule scheme, all of these things, Ayushman Bharat scheme, are covering up all the intervention radiology treatments to that extent that stents are also covered free for these patients under this scheme. So that way, fortunately, intervention radiology is able to reach the last mile or the poorest of the poor in the country.
Platform to tell you about this.
So, sir, can I clarify one thing? Fortunately, intervention radiologists across all metros or tier 2, tier 3 cities are available in most hospitals across the country. Though we may be small in number, but we are available everywhere. It is your right, when you reach to the hospital and you say, I have chest pain and I need to see a cardiologist, it is your right to ask for an intervention radiologist. If you create awareness through media, surely intervention radiologists are now not just operating, we are available for consultations also. So we are available for you to come across the table and discuss on consultations, how you consult your general practitioner. So we are available across the country. You have to ask for that.
Done. So the last question, sorry, you want to add
To
something?
clear your doubts, sir, I have done fellowship in 2006 in KEM. So whenever there is a patient of aneurysm or anybody who comes into KEM, he has been given an option of neurosurgeon, interventional radiologist, always. So we used to discuss with the patient that these are the options and these are the benefits of these things. Coming from there, I am now practicing in Apollo Hospital, Hyderabad. Even today, all the patients are being given the options. Which doctor do you prefer? These are all options available to you. So the doctor never decides for the patient. And once the patient has the knowledge that I want intervention radiologist, they cannot force you to go for surgery or anything. So it is always knowledge, awareness and knowledge.
Done. Thank you. So we'll ask one. Sorry, this mic. Can you hear me? Yeah.
Yes.
So one last question, then we'll wind up the question answer session. Abroad, there are many countries where there is a system where the success rate and the failure rate of individual doctors and maybe even institutions are displayed for public consumption so that they can make an informed choice. Our last question was about awareness and informed choices. Yeah. Is there any such system in play as far as your specialty goes? And is there any such system that will come in play in the future for medical science as a whole, and more so for highly specialized fields like yours?
This is the difference between developing and developed country.
Absolutely.
That's why we still call ourselves as a developing country, right? We are yet to cross that big hurdle of becoming a developed country. So I believe with the growing number of doctors over here, we will be reduced by lots of pressure of work, because government is planning that every district should have one medical college, right? So lots and lots of doctors will come. So we will get more time to scrutinize our work. Once we get more time to scrutinize, because right now we are overloaded with work. And with lots and lots of time to scrutinize our work, I believe we will soon become a developed country in terms of health also. So this is a process. This is not going to take maybe in next 2 or 3 years it will happen. This will take a decade or so. 10-15 साल 20 साल लग सकते हैं इसमें. And I believe we will soon become a developed country in terms of health also.
There has to be some data collection, data analysis, and then the outcomes. So this is what we need to do. All of us are aware, and as a society we are making an effort in that direction, that all of us contribute and decide. Now this meeting of complications is a very important part in our teaching program, that if I have done a complication, I want to teach my juniors that you should not repeat it. The whole idea is to improve the quality and improve the patient care, and that is what the whole purpose of this meeting. So these are the steps, and as time goes, data collection, data analysis and outcomes will be analyzed and brought up in front of people, that what we are doing, how much is good and how much is bad.
So Vivek, to answer your question, as you rightly said, we need to have some figures for the general patient or public to assess which particular treatment to opt for on that basis. So as rightly Dr. Vimal has said, as a society, we are in the process of establishing registries for various procedures that we do. So with these registries, with individual hospital as well as national registry, we will come out with the results of the outcome of our procedures. Vis-a-vis, we can compare it with other modalities of therapy, so patient can decide which one is better. And the best way to do it is to analyze it and publish it, and that is again one initiative that the society has taken, to have a journal which we call as Journal of Clinical Interventional Radiology, in which we will publish these results so that it goes to the scientific community to know that the advantages of these treatments. Also, as a society, we will be coming out with some consensus guidelines and quality improvement guidelines, as Dr. Vimal has said about this meeting. We'll come out with the complications, how to prevent them, as well as what can be the thresholds of complication, so that below that threshold we should remain, so that we can give safe treatment to the patients. So all this data will come out over a period of time, and that is how patients will get this information.
Thank you, sir.